I'm Dr. Sarah Silcox. I'm a small animal veterinarian, and although I've worked in both general practice and emergency medicine, I currently operate a house call based palliative and hospice care practice just east of Toronto, Ontario. I became interested in cannabinoid medicine, I think initially because the nature of house call practice is often a bit more of a personal relationship with your clients. And I had several clients who were medical cannabis users and confided in me that they were actually administering some of their medical cannabis products to their pets. And so, although I didn't know a lot about it at that time, I followed them and I offered support where I could. And it started me down the path of researching cannabis as a medicine. And then about 3 years ago, I was asked to speak at a cannabis conference on the use of cannabis for pets. And while I was preparing for that conference, I was speaking with colleagues, and in a discussion with Dr. Craig Mosley, we identified that there was really a huge need for veterinarians to come together as a profession and to make sure that we were advocating for our patients in this area, both in terms of access, but also in terms of making sure that the veterinary profession was well educated as we were approaching legalization. And so following that, we decided to form the Canadian Association of Veterinary Cannabinoid Medicine, and we're now coming up on 3 years from that. Canada legalized cannabis for recreational use as well as medical use, which we've had for several years, just over a year ago. And so when we reflect on how that has changed and affected the veterinary profession and veterinary patients, there's certainly several ways that we can see that we've been affected. First of all, anytime when we have increased access to cannabis and a reduced stigma surrounding cannabis, it's more likely that cannabis products are going to be left around the house, and that has no doubt increased the number of intoxications that we see coming into veterinary practice. Animals like to get into things, and so that's been a downside. But on the upside, that same reduced stigma has also improved our ability to have discussions with our clients surrounding not only the potential risks, but also the potential benefits and therapeutic uses of cannabinoids in veterinary medicine. One of our concerns, however, is that because currently any Canadian adult can purchase cannabis products through that retail market and use those for their pets, is they may not come in to talk to their veterinarian about doing that, and they'll take it into their own hands to start treating their pets at home. And that's a concern because we want to make sure that they're doing it as safely and appropriately as possible. And so we would really need to make sure that we stay on top of having those conversations with our clients, engaging them in those discussions, and making sure that any cannabis or cannabis-based therapies are being used in a responsible and safe manner. We frequently get asked by veterinarians, why is it that companies, groomers, pet shops, online retailers, gas stations can sell cannabis products, and particularly CBD products, and yet veterinarians are not able to dispense those and carry those on our shelves? And the answer is, as medical professionals, we're bound by the law, and if we break the law, we do risk disciplinary actions from our regulatory bodies. Currently, under the Cannabis Act for Canada, cannabis products, including CBD, can only legally be sold either through a licensed producer with medical authorization from a human physician or nurse practitioner, or through one of the provincially licensed cannabis retailers. Anything sold outside those two channels is not a legal sale, and therefore veterinarians can't carry cannabis products on their shelf. Unfortunately, although that's the law, it's also very poorly regulated or enforced. And what that means is there's really not a lot of incentive for these companies to stop selling those products. So it really becomes our job as veterinarians to make sure that we're educating our clients on the potential differences between both legal and black market products, let them know the things that they need to watch for and to be aware of, and to try and direct those towards more of a legal channel for obtaining their products. To make sure that we're educating our clients on the potential differences between both legal and black market products, let them know the things that they need to watch for and to be aware of, and to try and direct those towards more of a legal channel for obtaining their products. In Canada, veterinarians are not legally able to authorize medical cannabis use. However, any adult Canadian can purchase a range of cannabis products through the retail market and use those for their pets. This past year, the Canadian Council of Veterinary Regulators, the Working Cannabis Group, put together a list of guidelines for veterinarians that supports veterinarians having discussions with their clients surrounding the use of cannabis and offering them appropriate guidance. And this is vitally important because we know clients are going to be reaching for these products to treat their pets, and veterinarians need to be at the forefront of providing that information. Fortunately, those guidelines are being accepted by several of the provincial regulatory bodies. Both the College of Veterinarians of Ontario, the College of Veterinarians of British Columbia, and the Alberta Veterinary Medical Association have all adopted those same guidelines. And we're hoping that in the coming year, we'll see other provinces come online and follow with those recommendations as well. With legalization, we have definitely seen an increased demand from clients for information regarding the use of cannabis for pets. And while clients now have a wide range of areas where they can go and get information, which is great, some of that information isn't always the best information. And in fact, there's a lot of misinformation circulating out there on the internet and on social media. And so as veterinarians, I think it's really important that we encourage and engage our clients in having discussions surrounding cannabis and cannabinoid medicine to make sure that the information that they're getting is as reliable as possible. We get asked quite frequently, what is the timeline before we're likely to see changes within the Cannabis Act that would allow veterinarians to authorize medical cannabis use? And from our previous discussions with Health Canada, we know that it's likely going to be at least another 2 years before the Cannabis Act is reviewed in its entirety, which would provide an opportunity for changes to those regulations and allow veterinarians to authorize medical cannabis use as physicians and nurse practitioners can. However, we do know that as regulatory changes, there is the ability to make those changes sooner, but it would take tremendous pressure on the government in order to do that. And what we've learned from history is that human patients had to fight long and hard, often in court battles, to win the right to use medical cannabis to treat their symptoms. And so as veterinarians who have historically been fairly quiet on this front, we now need to stand up, to be heard, and to make sure that our concerns are being raised at all levels of government so that the people making these decisions know that this is a priority for Canadians, that accessing medical cannabis for our pets is important. And we can do that through several ways. Becoming a part of the CAVCM and joining us in our work with advocacy is a great way to start. Talking to your local government officials, and certainly making media involvement a priority as well, so that this story can be heard and people can join in and help us in this advocacy work. In the last 2.5 years of CAVCM work, we have seen some advancements on the advocacy front. Most importantly, we are incredibly grateful for the ongoing support of the Canadian Veterinary Medical Association, who has stood behind the need for veterinarians to be able to discuss cannabis with their clients and to be able to authorize medical cannabis as physicians and nurse practitioners do. We're also very grateful for the recent publication of guidelines put out by the Canadian Council of Veterinary Regulators, which supports veterinarians having discussions with their clients. And so at a professional level, we've made some great headway. On the federal level, the biggest advancement we've had to date is that with the retail market, including edibles, topicals, and concentrates coming into effect last October, handouts going to purchasers now include a warning to keep those products away from pets. And that's something we've been asking from the get-go to make sure that our patients stay safe, and it becomes doubly important with the advancement of products including edibles, which are so much more attractive to pet patients.